Greetings to all viewers. This is a video describing what diet is good in the first 3 months of pregnancy, which is also called the first trimester in medical parlance. So, I am Dr. Shobna Mohandas. I am a gynecologist working in Thrissur, and I hope you enjoy this video. The basic problems that occur in the first 3 months are nausea, vomiting, which occurs in practically 70% of women who undergo pregnancy. And when they can't eat much, they are worried whether my baby will get aborted because I can't eat enough to look after it. And so it's like a tightrope walk where you want to give into your nausea, vomiting, and not eat. But on the other hand, the woman wants to worry about her baby growing and she is worried about not eating. And even the caregivers are also worried about these things. So everybody says you have to eat for two. And when the nausea, vomiting causes a lot of weight loss, there is a lot of concern in the whole family because we have a close social network in India where everyone is worried about a pregnant woman. She has got a lot of friends and relatives. Basically, the fetus is just 4 millimeter, 5 millimeters in the first 2 or 3 months. By the time it gets to five, even 50 millimeters, it will be 3 months. So it's practically in few centimeters that baby is, and you don't have to really feed a whole lot more for a fetus that is just a few millimeters in length. So you really don't have to eat for two, not in the first 3 months. You do have food cravings in the first 3 months. And some people like eating a lot of sugars, and when they can't eat much by way of vomiting, they have to get their calories through sugars. And a lot of videos on the net I found that sugar can cause GDM. No, it's not really true. When a woman is vomiting a lot and she has a lot of decreased glucose in her blood circulation, at that point of time, it is good to take a lot of sugar. If she has craving for chocolates, she can take glucose. But if she has got gestational diabetes, if she's got diabetes seen in the first trimester blood checking, then she has to avoid sugar, not otherwise. In fact, in 2022 and 2023, there were two studies, and they found that it's the high calorie intake, more than 2,200, which is associated with gestational diabetes. That means if your glucose levels are normal and your calorie count is within the permissible limit, then you cannot get GDM. If you eat too much and worsen your calorie intake a lot, in fact, if you don't have nausea, vomiting, and you are eating more than you normally should, and you are increasing your calorie intake, that can cause GDM, not just eating sugars. Another point is you should avoid foods for which aversion is there. And why is there nausea? It could be because of the hormones, and it could be because the body wants to get away with things that are bad for the growth of the fetus, whatever be the reason. You have to avoid foods for which aversion is there, and you don't have to force a woman to eat all those things. Yes, all people, everybody is supposed to have around 46 grams of proteins, and a pregnant woman in her first 3 months also should be having that. So you have to know your count of proteins, which is high in chicken curry. You take chicken curry twice a day, you add your protein for the day. You have your fish curry, 19 gram, that you have it 2 or 3 times a day. You add your protein, even without any other. But if you have your moru curry or beans thoran, which is little, supposed to be rich, but you will have to have a lot of it. You will need more protein by way of other foods also. The protein-rich foods, as I said, was other non-vegetarian ones. But besides that, you have it in your eggs, chana, almonds, and chickpeas, and everything has got paneer. So all these things also have proteins. 100-gram rice has got 2 gram of protein. So even rice will have some amount of protein. So 100 grams containing how much protein in different foods. So if you see, paneer has got 18.3, that's quite high. Soya beans has got 52 grams, that's very high. Nuts has got 26 gram in 100 grams. So if you eat nuts 2 or 3 times, or you just add one fistful of nuts along with so many other things, you will achieve that 46-gram level that you need in your first trimester. Dals are 17 to 24 grams, and to achieve a 46 gram, you just need to take one fistful, that is 100 grams twice a day. Legumes have got 24 to 19 gram. Cheese is very high. So peanut butter, if you instead of putting a regular butter, you use peanut butter, you just take 2 slices and your protein content for the day is over. So intelligently find out the protein content of the foods and take proteins which are rich in take food which is rich in protein, and you really don't have to worry too much about anything else. You also need a lot of folic acid, and normally all doctors do give folic acid as supplement in pregnancy. Why folic acid? Because the neural tube, that is the brain and the spinal cord, is developed in the first 3 months. And for the cell differentiation, folic acid is considered a very essential vitamin. And besides the supplementation, you can also help your body by taking folic acid rich foods like legumes and chanas, and all sorts of legumes will have folic acid. All the fresh green vegetables with broccoli, capsicum, cabbage, lettuce, everything will have folic acid. Oranges, bananas are rich in not only folic acid, even B6. Papaya is rich in folic acid, though unripe papaya is a no. Eggs, tomatoes, our own guava, cauliflower, all have folic acid. So try to take a food that is rich in all this. You will complete your folic acid requirement. Thyroid deficiency is found in pregnancy, and some portion of thyroid deficiency is because of iodine deficiency. So you should make it a point to use iodized salt so that there is enough iodine in the food. Even curd or yogurt has got a lot of iodine, so you can substitute that also. You need a lot of vitamin B12 also in pregnancy, but generally we do not supplement because our diet is fairly okay in vitamin B12, especially non-vegetarians, because all the meat contains B12. But even vegetarians, the nuts, again, avocado, pista, badam, even your ginger, pomegranates, broccoli. So a lot of green leafy vegetables are rich in B12. So try to incorporate all the green leafy vegetables and some amount of non-veg if you are a non-vegetarian. That will supply the B12, the folic acid, the protein, and everything. So, having had enough of protein and folic acid, what else? Suppose you have nausea and vomiting in pregnancy, you have to take the diet in such a way that the nausea is less. As soon as you get up in the morning, take some dry food instead of taking a lot of water, something like crackers or bananas or something like that. Even the bananas are rich in B6, which is also a antidote for vomiting in pregnancy. We give vitamin B6 tablets to patients to prevent nausea. So if you take a banana, that will supply a lot of B6 also. Ginger is supposed to be anti-vomiting. Taking ginger juice or ginger candy many times a day, it will help in reducing the sensation of throwing up. Lemon, we all know, is good. Smelling lemon is good. Lemon juice is good. Whichever way, you just put a little lemon here, there, that's also good. Now, fennel is supposed to be good to reduce the acidity in the stomach. But some studies have shown that excess fennel, lot of it, if taken together, can cause vaginal bleeding. So don't look at that report of fennel can cause bleeding and then get scared of fennel altogether. It's not like that. A lot of it is required to cause vaginal bleeding. Little bit of pinch here and pinch there can help in your acidity, and it will not cause vaginal bleeding. When you feel nauseated, don't take a lot of masala foods. Take bland foods like plain bread or even your rice gruel or cornflakes. And whenever prenatal vitamins have to be taken, do take them before your food. So, because when you take it after food, again, that nausea comes for some people. They can't tolerate the prenatal vitamins also. So, it's good to take it before the food. Again, I told you vitamin B6 foods can remove the nausea. It is highest in chickpeas, tuna or chura, it's a type of fish. Even salmon uh, has got 35. Banana, boiled potatoes, paneer to some extent. The amount is written in the here. So you can take these food items to improve your vitamin B6 levels, which can in turn help in your nausea, in quelling the nausea. Again, when you're eating food, take small amounts, 6 or 8 times a day. It's generally the norm to take food 3 times a day: breakfast, lunch, and dinner, and some little snacks in the evening. But so instead of gorging at these three intervals, try to take small, small quantities. As soon as you get up and take a little bit, take your breakfast at 11 o'clock, take a little bit at 1 or 2, whatever. 4 o'clock, again dinner, then again before sleeping, take something. That way, don't feel shy if you're eating all the time, because as a person who has got nausea, you cannot eat a lot. Therefore, you cannot match your eating hours with the people at home. You have to eat at all the times with, even though it is in small quantities. That way, you won't feel so tired in spite of being nauseous. So basically, women who take a lot of fresh fruits and vegetables during pregnancy do have less chance of having an abortion. This has been found in studies because they contain a lot of antioxidants which will prevent abortions. So taking vegetables is important, and taking vitamin B6 would be the vegetables containing vitamin B6 will reduce the nausea on one hand, and on the other hand, it will prevent an abortion. What about pineapple and papaya? Basically, pineapple and papaya cannot cause abortion. It's only the ripe papaya, the raw papaya. The ripe papaya is safe. The raw papaya can cause abortions or cervical dilatation. Pineapple is supposed to contain bromelain, but the studies which have shown action with the bromelain are for large amounts of pineapple. If you just take a few pieces of pineapple here and there, it is not going to cause abortion. And papaya especially is very rich in a lot of minerals and antioxidants. Pineapple, on the other hand, can worsen the acidity that happens during pregnancy. And though it is good to the tongue, you may feel a little, burning sensation if you take too much of pineapple. What about chocolates? A lot of women have craving for chocolates. In fact, studies have shown that you will have less amount of blood pressure in your pregnancy if you take chocolate. The miscarriage rate is less, and for whatever reason, the babies are born of women who are taking chocolates, they have happier babies. These are studies which have come and just quoted in the Times of India. So finally, having said a lot of controversies which may be different from what you may be seeing in other videos, I would advise you to individualize the diet according to the patient, and not go by random advice from all relatives. Go with scientific data and have a breezy pregnancy. Thank you for the patient listening. I hope you enjoyed.